Imagine two neighbours. Both are 68 years old. Both walk every morning. Both cook healthy meals. Both feel perfectly fine. One of them goes to the doctor for a routine checkup. The doctor says, "Let's order a few extra tests. They're just precautionary." Nothing seems unusual. But 2 months later, that healthy neighbour has undergone 3 scans, 2 biopsies, 1 surgery, and is taking 5 new medications. Meanwhile, the other neighbour never had those tests. 3 years later, she's still gardening, travelling, and playing with her grandchildren. So what happened? Did medicine fail? Not exactly. The problem is something doctors rarely have enough time to explain. Sometimes, finding more doesn't actually help you live longer. Sometimes, it simply creates anxiety, unnecessary procedures, and complications that never needed to happen. Today's video isn't about avoiding doctors. It's about becoming an informed patient. I'll share 5 medical checkups that I personally would think twice about after age 65. And more importantly, I'll explain exactly why. Stay until the end because checkup number 5 surprises almost everyone. And before we begin, tell me in the comments, how old are you today and where are you watching from? I love reading every response. A different way to think about aging. Here's something medicine doesn't talk about enough. At 35, the question is, how do we find disease early? At 70, the question changes. Will finding this actually improve my quality of life? Those are very different questions, because aging changes everything. Recovery takes longer, complications happen more often, and many slow-growing conditions will never become dangerous during your lifetime. Yet once they're discovered, it's incredibly difficult for the medical system to simply ignore them. That creates something called the medical domino effect. One test leads to another leads to a scan. The scan leads to a biopsy. The biopsy leads to surgery. And suddenly, someone who felt completely healthy becomes a full-time patient. Let's begin with the first checkup. Checkup number 1, full-body CT scans. Just to be safe. They're heavily advertised. Some private clinics promise peace of mind. Others market them as life-saving technology. You lie down. The machine scans your entire body. Within minutes, you receive hundreds of images. Sounds amazing. But here's the problem. The human body is full of harmless abnormalities. Tiny cysts, small nodules, benign growths. Most people have them. Most never cause symptoms. Yet CT scanners are incredibly sensitive. They detect everything. Doctors even have a nickname for these findings. They call them incidentalomas. Things you weren't looking for, that suddenly become impossible to ignore. Michael was 69, healthy, retired firefighter. He paid for a private full-body scan because he wanted reassurance. Instead, the report found a tiny spot on one kidney. It probably isn't anything, but probably wasn't enough. He underwent another scan, then another, then surgery. Months later, the pathology report confirmed the tiny growth would likely never have caused problems. But the surgery caused complications, and he spent 6 months recovering. Sometimes, the treatment creates more harm than the finding itself. Better alternative. Instead of searching your entire body for hidden problems, focus on blood pressure, cholesterol, exercise, nutrition, sleep, and regular physician visits. Those habits improve lifespan far more consistently than unnecessary imaging. Checkup number 2. Routine vitamin panels every year. This surprises many people. People spend hundreds of dollars checking vitamin D, vitamin B12, magnesium, iron, zinc, folate, and dozens of other markers every year. But if you're healthy, have no symptoms, and eat reasonably well, many experts don't recommend extensive routine testing. Why? Because numbers naturally fluctuate. One slightly low value often creates panic, then supplements, then repeat testing, then higher doses, sometimes for years, without any proven benefit. Example: Sarah, age 72, felt wonderful. Her annual wellness package showed vitamin D slightly below the laboratory range. She immediately started taking large doses. Months later, she developed kidney stones. Her calcium levels became elevated. Ironically, the fix caused a bigger problem than the original test result. What matters more? Instead of chasing perfect numbers, pay attention to energy, strength, balance, sleep, appetite, and physical function. Those are often much better indicators of healthy aging. Why more testing isn't always better. Imagine checking your smoke detector every 5 minutes. Eventually, you're going to hear a beep. Not because your house is burning, but because batteries get weak, dust accumulates, and devices aren't perfect. Medical testing works similarly. Every test has false positives, false negatives, and uncertainty. No test is perfect, and after age 65, those false alarms often trigger a long chain of additional procedures. That's why informed decision-making becomes so important. Before agreeing to any routine screening, ask yourself 4 questions. Why am I getting this? What happens if it's positive? Will treatment improve my life? What happens if I simply watch and wait? Those questions alone can completely change the conversation. Sometimes the greatest health risk isn't the disease, it's the unnecessary medical journey that begins after an unnecessary test. Today, we're continuing with 3 more checkups that deserve careful consideration after age 65. Remember, this isn't about avoiding doctors. It's about asking better questions and making decisions based on your individual health, not fear. Let's continue. Checkup number 3. Routine thyroid ultrasound. Without symptoms. Here's something fascinating. If we performed thyroid ultrasounds on 100 healthy adults over 65, more than half would probably have at least one thyroid nodule. That sounds alarming, until you learn one important fact. Most thyroid nodules are completely harmless. Many never grow. Many never produce symptoms. Many never require treatment. Yet the moment one appears on an ultrasound report, the next steps often begin automatically. Another scan, needle biopsy, repeat imaging every 6 months, sometimes surgery. A real-life story. Linda was 71. She went for a carotid ultrasound offered at a local health fair. The technician noticed a tiny thyroid nodule and suggested further evaluation. She wasn't having swallowing problems, no pain, no symptoms, but she became anxious. Within 4 months, she had 2 ultrasounds, 1 biopsy, multiple specialist visits, and eventually surgery. The final pathology report? A tiny, slow-growing tumour that experts believe may never have affected her health. Now she takes thyroid medication every single day. Not because she felt sick, but because of an incidental finding. What matters more? If you notice difficulty swallowing, rapid growth, voice changes, or neck swelling, absolutely seek medical evaluation. But routine thyroid imaging in healthy adults without symptoms often creates more anxiety than benefit. Checkup number 4. Annual cardiac imaging when you feel fine. Many people believe, if I scan my heart every year, I'll prevent a heart attack. It sounds logical, but medicine isn't always that simple. Your arteries naturally change with age. Small plaques are common, minor calcium deposits become common. Imaging often discovers these normal age-related changes. Then comes the difficult question. Should we intervene? The hidden problem many adults undergo. CT angiograms, stress imaging, repeat echocardiograms, or advanced heart scans despite having no chest pain, no shortness of breath, no exercise limitations, and excellent daily function. The scan reveals mild narrowing. Robert, age 73, walked 5 miles every morning, played golf twice every week, never had chest pain. A routine executive health package included advanced cardiac imaging. The report showed mild coronary plaque. Over the next year, he underwent multiple specialist consultations, additional testing, and started worrying every day that a heart attack was imminent. Ironically, the stress affected his sleep, his exercise, and his quality of life far more than the plaque itself. Better investment. Instead of chasing pictures, focus on habits. Walk daily. Maintain healthy blood pressure. Sleep well. Eat whole foods. Build muscle. Manage stress. Those behaviors consistently reduce cardiovascular risk, regardless of what a scan looks like. Understanding risk. One mistake many people make is believing medicine can eliminate uncertainty. It can't. Every person over 65 will have something that looks abnormal. Small cysts, tiny plaques, mild arthritis, benign growths. The question isn't, can we find something? The question is, will treating it actually improve my life? That's a much smarter question. Checkup number 5, routine carotid artery ultrasound, without symptoms. This checkup is extremely popular at community screening events. For a small fee, people are told they can discover hidden stroke risk. Sounds reassuring. But here's what often happens. The scan detects mild narrowing, something incredibly common with aging. The report sounds frightening. Plaque detected. Immediately fear takes over. But here's what research shows. Most mild carotid narrowing never causes a stroke. Many people live decades without symptoms. Yet once it's documented, more testing often follows. Then consultations, sometimes surgery, and every procedure carries risk. Ironically, procedures designed to prevent stroke can themselves occasionally cause stroke complications. That's why many professional organizations do not recommend routine carotid screening for healthy adults without neurological symptoms. Now there's anxiety. Additional appointments, more medications, sometimes invasive procedures. Even though the person was living perfectly well. George, age 76, attended a community health event. He felt perfectly healthy. His screening found moderate carotid narrowing. He spent the next 6 months visiting specialists, reading frightening internet articles, and worrying constantly. Eventually, after multiple opinions, his doctors recommended no intervention at all. Everything returned to normal. Except one thing. His peace of mind never fully recovered. The biggest lesson. Getting older doesn't mean chasing every possible test. It means becoming smarter about which tests truly matter. Sometimes, watchful waiting is excellent medicine. Sometimes, doing less protects your independence more than doing more. Good medicine isn't measured by the number of scans you receive. It's measured by how well you continue living your life. 5 questions every adult over 65 should ask. Before agreeing to any routine screening, ask your doctor these questions. Question 1. How likely is this test to find something that actually needs treatment? Question 2. If the test is abnormal, what happens next? Question 3. Will treatment improve my lifespan or simply change my medical record? Question 4. What are the risks of additional procedures? Question 5. If we do nothing, what is the most likely outcome? These 5 questions shift the conversation from fear to informed decision-making. Lifestyle wins every time. Want the truth? The biggest improvements in healthy aging rarely come from expensive testing. They come from ordinary habits repeated consistently. Walk every day. Eat enough protein. Strength train twice a week. Sleep 7 to 8 hours. Stay socially connected. Keep your blood pressure under control. Drink enough water. Manage stress. Laugh often. Those habits reduce hospitalization, preserve independence, and improve quality of life far more than many routine screenings. One of the greatest gifts you can give yourself after 65 is confidence. Confidence to ask questions. Confidence to understand your options. Confidence to remember that more testing doesn't always mean better healthcare. Because the real goal isn't collecting normal lab reports. The real goal is waking up with energy, enjoying time with family, walking without pain, traveling, gardening, playing with grandchildren, and living the life you've worked so hard to build. It's about avoiding unnecessary healthcare. There's a huge difference. The goal isn't to fear doctors. The goal is to work with them intelligently. Because after age 65, the greatest predictor of a long, independent life isn't how many scans you've had. It's how well you protect your body every single day. So today, instead of focusing on what I would avoid, let's talk about what I would never ignore. These simple checkups and habits have saved countless lives and can help you stay active well into your 70s, 80s, and beyond. Health checkup number 1. Blood pressure monitoring. If I could recommend only one health measurement after 65, this would be it. High blood pressure rarely causes symptoms. That's why it's often called the silent killer. You can feel perfectly normal while your heart, brain, kidneys, and blood vessels slowly experience damage. Story. Henry was 72. He walked every morning, never smoked, never felt dizzy, never had headaches. One afternoon, his daughter bought a home blood pressure monitor. Just for fun, she checked his reading. It was 182/98. He felt completely normal. His doctor adjusted his treatment, and within weeks, his readings returned to a much healthier range. That tiny machine may have prevented a future stroke,